Hello, my name is Anna Mosley. I'm a community specialist nurse, and today we're going to be talking about Fowler syndrome. And I'm going to be joined later by Elle Adams, who's been living with this condition, to go into it a bit more. So what is Fowler syndrome? Fowler syndrome is a condition that affects younger ladies, so anything between the ages of 20 and 30, but the average age that people tend to be diagnosed with Fowler syndrome is 26. The problem is that you are unable to pass water and you can become in retention being that you're holding the water in your bladder. And this is due to your sphincter not being able to relax. There's also been some evidence which has shown that 50% of ladies that have been diagnosed with Fowler syndrome can end up with polycystic ovaries. So what are the key points that I would go through with the patient before commencing ISE? I think first and foremost we need to be able to get consent from the patient. It is a very intimate procedure and I want the patient to feel comfortable with myself and with their body, so we have to gain consent. Secondly is to understand your own anatomy. So that means knowing the difference between your vagina and the urethra and knowing where the urethra is. Also, it's in understanding the importance of hygiene. If we're going to be doing ISE, it has to be in a very clean area and making sure it's a comfortable area as well for the patient to insert the ISE. Also to go through the risks and the benefits. The benefits being that when it works, it's going to be emptying the bladder. The risks being that you can introduce infection if it isn't hygiene, and you can cause some trauma if you're not putting the ISE in the correct area. Something else to consider when I'm going to see a patient who wants to start ISE is patient choice. There are lots of products out there, lots of different ISE products. The main difference between some of them is they can be a gel ISE, they can be a hydrophilic ISE. The most important thing is the patient feels comfortable in using it. So by giving them options and choices, they can use the one they're going to feel more comfortable with. I'm delighted to have with me now Elle, who's going to talk to us a little bit about her experiences with Fowler syndrome. So hello Elle, nice to meet you. If you can tell us a little bit about yourself.
Lovely to meet you, Anna. My name's Elle Adams and I was diagnosed with Fowler syndrome in October 2020, which is coming up to 5 years, and I can't believe that time's gone so quickly. I've lived with Fowler syndrome ever since.
Okay, so just a little bit of history behind that. So when did you first notice some problems or any symptoms? What made you realise something was wrong?
It was all very sudden and quite dramatic, really. I'd never had a single symptom until I went to bed one night, woke up in the morning, tried to pee, and I just couldn't. I thought, I'll give it an hour, I'll give it some time, I'll relax, and nothing happened. So it was at that point that I thought I need to go to A&E and something needs to happen. So that's when I took myself off to A&E.
Yes, that sounds quite scary. So you get to A&E and, I mean, what did they do? They examine you or?
They did. They used an ultrasound and they said you have a lot of fluid on your bladder.
It must be quite uncomfortable as well.
It was so uncomfortable. Yeah. The only way that I can describe it is if you are so desperate to pee and then you're just left and left and left and there's no solution. So eventually I was catheterised and there was over a litre of urine on my bladder.
Was that the indwelling catheter? So they put one in with the balloon attached to a bag, was it?
Attached to a bag, and it just kept coming.
Gosh.
It was just so,
relief, I suppose.
The relief was incredible. It's amazing really because it was terrifying, but I was still so naively thought, well, this is just a one-off. I'd never had anything like it before. So I thought, well, this is just some strange thing that's happened. This will be a funny story to tell people in a few days. And I had no idea that this was really the beginning of the next chapter of my life.
Okay, so they put the indwelling catheter in. Do they discharge you home with that catheter in? And what's the plan after that?
Yeah, so my options were take it out, try again. And they said to me, we just really don't think that you'll go, that you've shown no signs of being able to. So the other option is go home with the indwelling catheter and come back when you get the next appointment, which just happened to be 2 weeks later.
Okay, so you have the catheter at home for a couple of weeks. It's draining okay, I suppose?
Yeah,
no problems. go back into a hospital and they take it out?
Yeah, so I managed to get an earlier appointment within a week because I think especially when you're new to catheters, I mean, they're never truly comfortable anyway, but having an indwelling catheter for the first time was really quite an experience and, you know, physically tough, mentally tough as well.
Of course,
not
having
knowing,
something strapped to your leg.
Exactly, and just kind of not knowing what lies ahead. You know, is this going to be me forever now, or is this just a weird week? So I went back in and they performed a TWOC, a trial without catheter. And again, I was quite confident really. I thought, well, you know, can't see why I wouldn't be able to go. And I failed that spectacularly. And that's when I was taught to self-catheterise.
Okay. So you're introduced to ISC. So just so I have a better understanding, did you meet a nurse specialist and how was it brought about? You know, were you at the hospital or at home?
Yeah, so when I had the TWOC, I spoke to a consultant after who said, you know, your options are keep the indwelling catheter, which was my idea of a nightmare. I really, really didn't want that because life is just, you're so inhibited, aren't you? So they suggested ISC. And it was a nurse specialist who taught me how to do that. And it's funny really because at the time it was so terrifying and I really didn't want to have to do that because I guess I was in denial that this was where I was at. And actually ISC has been the thing that's changed my life and allowed me to live such a normal life now, or as normal as can be with Fowler syndrome.
So what would you say? You said it was quite scary.
Yeah.
So is it scary that you're going to do harm to yourself, or is it responsibility? In what way did you find it scary?
Yeah, well, I guess the responsibility of I have no idea what I'm doing. I guess even as you know, even finding your urethra was like incredibly. It's so hard. I'd never seen that anatomy up close before. I had never even heard of ISC before it was mentioned to me. So it was all so new, and I think. When I was taught quite quickly, which was totally fine. But I think, you know, as someone who's learning fresh off the bat, I remember saying, "Can you just show me that again? Can you?" And the lovely nurse was saying, "Well, I can't keep catheterising you," but I just didn't feel like I knew what I was doing, and I was quite nervous to go home and do that myself without the specialists around.
And then when you did get home, do you find that you found there was a particular position that was best for you to be in, or you know, in the toilet or in a bath, or you know, did you feel, did something just click eventually, or?
Eventually,
how long did it take?
It took a while.
Yeah.
It took a while. Positions, honestly, I ended up in all sorts of positions to try and find what would work. I just remember having mirrors everywhere, and I was lying on a bed at one point, which I know makes no sense. But at the time, it was kind of like, where am I going to do this? And I had a lot of support from family because I honestly don't know how people do it by themselves, and in the end, I ended up in a much better position in the toilet and kind of look back on all my previous ones of like, you know what, you gave it a go. You gave it a go.
It works for some people.
Yeah, exactly.
It's such an individualised thing, and I think what a lot of patients say to me is that a few weeks ago, I just don't think I'll be able to do this, and something just clicks.
Yeah.
The positioning clips, you know, knowing where to put the ISC.
Yeah.
Is there any tips you would give to anyone first starting out?
Yeah. Well, I actually have a mirror that clips onto the toilet, and I still use that now, even though it's been years, and I could probably find it with my eyes closed whilst, you know, on a roller coaster. But I think one thing that was drilled into me early on was the risk of infection. So I've always tried my best to limit that as much as possible. And just being able to see it with the mirror, you can see exactly where the urethra is without, you know, touching any other area before going in. So in terms of tips, having the mirror is really nice. But I think rather than tip, my advice or something I wish someone would have told me is this feels like the most terrifying thing that you'll never get used to. But as you said, you will. In weeks, maybe even months, you will look back and it will just, you sort of don't even realise that you're doing it. You're out and about, you're living your normal life. You know, I feel like there's always a first, whether it's on an aeroplane or, you know, in a cafe or a toilet that's smaller than others. There's always a first time that you have to do something that's a little bit difficult, but then you do it and you know for next time.
I think it's brilliant as well hearing that from you, because I can say to patients it will just click, but hearing someone that's actually been through it and say that it does click will make a huge difference.
Yeah, it is. It was life-changing for me, and I always say it was the one thing that felt really defining in where my life was going. Like, it was the first time I had to accept I have a condition, even though it wasn't diagnosed at that point. But now I look back and my catheters are like the best thing ever, because they allow me to live a normal life, and I don't have a leg bag. I don't.
Gives you that freedom, I suppose.
It's freedom.
It? Yeah.
That's exactly what
Fantastic.
It is.
So there's lots of ISE catheters out there, and I think that the longer that you do ISE and you start to investigate and see what availability there is, I think that's when patients, you know, try and seek out different catheters. What was your experience with what you were sent home with, and what you ended up on, and what you prefer?
So I have only ever used gels because that was just what I was given. And I didn't really know that there was any other options. I didn't know that there was a choice. As you say, later on down the line, I realised that there was different sizes. So I did order some from my suppliers, and actually I was using the best one for me anyway. But I think it is that the longer you do it, you do kind of just research on your own to find what works best.
I think the longer you have something, it's like you research it, you think, oh, that looks nice, and you think, I'll give that a try. And I think it's really important, especially in my job, that I would try to make sure the patients are aware of choice.
Yes.
And, you know, you can be your own advocate, or I can be your advocate to make sure that you're using something that works for you, that you're comfortable with.
Yeah, and that's exactly it. What I hope for future patients is to know that, because especially I was quite lucky that they just worked for me straight away. But if they didn't, you know, you wouldn't be wrong in thinking, oh, this isn't the best option for me, ISE, whereas actually it really quite well could be. You're just not having the best actual catheter for you.
Mm-hmm. So what I found in my role is sometimes patients can struggle in relationships, you know, having to have those conversations, you know, things around embarrassment. So how did you feel that it affected your relationship?
Yeah.
Or relationships?
Well, I was actually single at the time, and I met my husband a matter of weeks after I first went into retention. And I guess I laugh about it, but I feel quite sad thinking about it now, because I remember going away and staying at his, and I would hide the catheters in the bin. You know, I'd put it under anything else that was in there, because I felt like I wanted him to get to know me, who I was, without this kind of terrifying story underneath it. Because, you know, especially being so early on, it was taking me a while to get used to having Fowler syndrome and accepting that. So I was trying to remember the old me before Fowler syndrome, and I wanted him to meet that version of me as well. But actually I was very lucky. I mean, I say lucky, it is the bare minimum to be supportive of someone with a condition needing catheters, but he was amazing. And actually what's really nice, I think he was just quite impressed with it, you know, like, you
can do that.
Exactly, yeah, like you're exactly who you are, and you're all of these things, and you do that as well, as opposed to, I think it added to who I was as opposed to took away from.
I think that's really good advice as well, that you said at the beginning, you got comfortable with it yourself first.
Yeah.
You know, the relationship we ourselves have with our body, and then we can consider other people's feelings.
Exactly.
I think that's really good advice. Also, as well, as regards to getting pregnant, having a baby, you know, how does that interfere? Did you have to have any extra follow-ups, or?
Yeah, I mean, to be honest, I think the biggest way that it inhibited me was actually the decision whether I would have a baby or not, because I knew that being pregnant, just the sheer size of being pregnant, I knew would make catheterising difficult, seeing things, being able to reach areas. And it was a hard choice, honestly, and the very best choice, because my little 10-month-old is like the best thing in the entire world. But it was really difficult, and there were times when I was pregnant, you know, I had to make sure my husband could catheterise me if I needed to. My mum was able to do it, and though pregnancy is hard enough as it is anyway, it's those additional things that you just that are so big actually that you would never realise unless you had a condition like that. So it was hard. I actually managed it better than I thought. As you know, you get to a certain point, 6-7 months, I think I'm not sure how I'm going to reach this anymore.
Did you have to use a slightly longer catheter, or
no? I stayed with all of the same catheters that I used, and it was actually just, you find different angles, you find different techniques.
Bigger mirror.
Exactly, much bigger mirror, yeah. I could barely see my toes, so that was quite interesting. But it was one of those things, I think, the end of pregnancy is so tough anyway, that we just got to the end of it. But I had a C-section actually for my birth because of my Fowler syndrome, so catheterising after was quite difficult, just
did they put an indwelling in immediately?
Yes. Yeah, which, was a whole... People would say to me, what are you most nervous about? What part of the birth and having a baby? And I would say, I'm not being naive because I know that part is going to be incredibly hard, but my biggest fear is what it's going to do to my bladder. And having that indwelling catheter after and having it taken out and see... Because I have partial retention, so I don't always catheterise. And will I be able to go by myself? And will I be able to catheterise? So there was so much to it, and it worked out okay.
I suppose with anyone having a baby, there's always the what is going to happen, but you have that added dimension that you have a condition prior to consider. And I suppose nobody can tell you this is going to happen, that's going to happen, because we're all different, isn't it?
Exactly.
So, but worth it in the end.
So worth it, so worth it. Even when she keeps me up all night long, she's so worth it. But it is tough, and I think it's also important to acknowledge that, because you go through a lot anyway, but you just go through that extra bit for the best end result, but it's a lot.
So obviously it's really important that you want to get back to doing normal activities, and a question that comes up a lot is about travelling with ISC. So have you been abroad since you've been doing ISC or travelling?
Yeah, I have, and I have to say the first time I was nervous just to be, far from the hospitals, far from all the doctors that have looked after me. But it is just preparation, isn't it? Getting ahead of trying to work out everything that I need. So for me, the first thing I packed before my hundreds of bikinis was my boxes of catheters, and that was ticked off numerous times to make sure that I had them. And then wipes and my little anti-bac on the go. And that is pretty much me. As long as I've got those, I'm like, right. And my mirror, obviously.
Do you kind of take more than what you may need, just in case? Yeah.
Yes. To the point of being ridiculous. I don't know how many times I think I'm going to pee during the day, which is normally quite a lot, and then I'll double that. So always more than I need, just to be on the safe side. And spread across bags. So suitcase.
Just going to ask that. So if one goes missing.
Exactly. Yeah. My hand luggage, my husband's hand luggage bag. Now they'll be in my daughter's changing bag everywhere. As well. Just everywhere. Yeah, in a pocket. Anywhere that I can squeeze them in,
Okay, and was there anything you were nervous about, like going through security, or were you feeling okay about that?
I was feeling okay about that, but I have had some interesting conversations going through security. I think, especially because they're not obvious. If certain catheters are actually really quite discreet, which is lovely, until you get the security sort of going through your bags and having a look and trying to work out what they are. So I've had a fair few conversations where I have to explain that's a catheter, and then the mirror, they're kind of looking at it like, what is this weird contraption? Like, it's just a mirror, to help me catheterise.
I suppose it's just the more people do it, the more education there'll be out there, and it will be self-explanatory. But with anything, it takes time for that information to seep through, doesn't it?
Exactly.
Do you need any sort of letter from your GP or any extra insurance when you're going abroad?
Yeah. Well, I thought that I would, but every insurance that I've spoken to, it just falls under Fowler syndrome for me, because catheters, I think it's because they're classed as almost like a treatment or it's a medical appliance as opposed to a condition itself, like catheterising isn't a condition. So for me personally, but I always say please check yourself when you're travelling, but for me it's always just fallen under the Fowler syndrome bracket.
Okay. And you don't need any, so when you've got your ISCs in your hand luggage, are they deemed as liquid, or do you have to put them in a clear bag, or are they?
Well,
because it keeps changing, doesn't it?
Yes,
the guidance.
I always try to put them in the clear bags, but because I spread them everywhere, there's always a rogue one that's in a pocket somewhere, and I've never been stopped because of them. So I think you could probably get away with not doing that. But again, I am at an airport. I'm a very relaxed person, but at the airport, especially going through security, I just want to get through safe and sound and happy. So I do everything by the book. So those go in the bag for me.
So you can enjoy your holiday.
Exactly.
Because there's absolutely no reason you can't, travel and enjoy yourself if you've got IAC.
Yes, exactly.
Fantastic. So have you been given any guidance or sourced any guidance with regards to food and hydration and what's best to do with your ISC?
I wasn't given anything at all.
Thought you might have sourced it.
I did source it, yeah. That came a bit later actually, because as we said, I think you get so used to just trying to get used to catheterising and accepting the new life, that once I did and I was like, you know what, I've got this down, I know what I'm doing now I'm going to look to how else I can help myself. But I think if I'm honest, the main thing that I do is just stay hydrated. Water is key. In terms of foods, I eat mostly healthy. I eat quite healthy, but I love a chocolate bar here and there, a couple of times a day. I love a bag of crisps. But on the whole, just your very classic healthy, get your vegetables in, get your fruit in, and stay hydrated.
I think you'll find that kind of goes hand in hand with if you're eating the right foods and you're eating enough fibre, you're not getting constipated, because obviously with constipation that can aggravate it.
Yes.
Keeping hydrated is fantastic. Is there any drinks that you avoid?
Yes, so I don't really drink any caffeine anymore, so especially coffee. I will have the odd decaf latte, but apart from that, no, I avoid caffeine at all costs, and I try not to drink too much fizzy as well, or anything super sugary and sweet.
Like citrusy?
Yes, exactly.
Anything that's going to irritate
and aggravate, I will avoid at all costs. Even though sometimes it's so tempting, you just think, oh, I'd love that Diet Coke, or oh, I'd love that milkshake, and it's like, you know what?
It's not worth it.
It isn't worth it for, those few minutes drinking, it's not worth it for the hours or days after.
Well, there are actually a few guides now, and there's some that you get online and it's got all the information on there. So I think moving forward that will help patients.
Perfect.
So you said about when you kind of got your head in the, you got your head around what you were doing. Did you find that it affected your mental health at all, or did you have to get any help with that?
I probably should have, but I didn't, because I think just the way that I am, I'm very much here's an obstacle, let's almost get over it, and actually ISC and Fowler's isn't something you just get over, you have to live with it. So I'm very lucky that, in case you couldn't tell, I'm a talker. So I talk to everyone, my mum, my husband, and my friends, and I'm really lucky that they've been sort of my therapy through it, and I've been able to accept it and really kind of learn to live life instead of just existing with this illness. So I haven't sought any help, but it is something that I would really recommend people doing, because for me, I know everyone's experience is different, but obviously I went from being completely healthy one day to this whole, condition starting the next day. So I really would recommend people talking, because it's a lot to get your head around and it is difficult.
So with regards to exercising, keeping fit, were you giving any guidance with that? Has there been any sort of restrictions or anything?
Not necessarily. There's no restrictions in terms with ISC, and I actually have a sacral nerve stimulator in my spine, which I find can make exercise a little bit more difficult. But I have a 10-month-old baby, so I have barely any time for that anyway. So walking, because she will only sleep in the pram, walking for sometimes hours a day is my exercise, and I love it, actually. So that's great for my mental health, great for my physical health as well. The only thing that I do is wherever I'm going, I will plan ahead. Where's all the toilets, just to make sure that I've got my sort of exit strategy, if you will, so I know what I'm doing. But exercise-wise, it would be nice to get back into something, because I do think keeping your body as healthy as can be apart from the condition that you've got, is the best thing that you can do.
Well, thank you very much, Ellie, for coming today and being so positive and being so open about talking about your condition. Thank you so much.
Thank you.
And thank you very much for watching.